Good morning. My name is Chinyere Ogugu, working on my week 3 video assignments, starting with the cranial bones. Here, this region here is the frontal bone. Here is the parietal bone, and behind here is the occipital bone. Right behind and the center here is the external occipital protuberance, which connects the cervical vertebrae to the skull. Next is the temporal bone, starting with the temporomandibular joint. This area here is the temporomandibular joint. The mastoid process. Styloid process. Auditory meatus. External auditory meatus. Squamous part. Petrous part. It's internal. We cannot see it. It's the houses the middle and the inner ear structure. The internal auditory meatus is also internal. It is for the passage for the facial and the acoustic nerve. With the bone, the sphenoid bone. The sphenoid bone is an inside bone in the eye. It's been in the eye, and the lateral parts and orbital parts of this eye has the greater wing. And in the greater wing is the superior orbital feature. The superior orbital feature transmits the cranial nerve. It transmits the cranial nerve, the oculomotor, trochlear, the ophthalmic branch. Also is the internal view of this sphenoid bone. In the internal view, it has the lesser wing, the greater wing, the optic canal, and the optic canal transmits the optic nerve and ophthalmic artery. Also, this sphenoid bone has the sella tussica. The sella tussica has a depression called the hypophyseal fossa, which cradles the pituitary gland. Continuing is the ethmoid bone. The ethmoid bone and the sphenoid bone are both situated posteriorly to the nasal bone and the frontal sinus. Both the sphenoid bone and the ethmoid bone are positioned posteriorly, which means post, behind the nasal bone and the frontal sinus. This ethmoid bone consists of two major bones, the crista galli and the cribriform plate. The crista galli helps secure the brain in the cranial cavity, while the cribriform plate transmits axons called fila olfactoria. Next is the suture part. Starting with the front coronal suture, sagittal suture, the lambdoid lambdoid suture, and the square mouth suture. The square mouths in this area, the square mouth suture. Continuing is the facial bones. The facial bones, the mandible, the nasal bone, the zygomatic bone. The zygomatic bone is made up of the temporal process of the zygomatic bone and the zygomatic process of the temporal bone. Next is the ethmoid bone. Next is the vomer bone. Like at the tip of the nose. And it's made up of the perpendicular plate of the ethmoid bone and the vomer. It's made up of the perpendicular plate of the ethmoid bone and the vomer. Next is the inferior nasal concha. I believe it's internal. Inferior nasal concha. Right there somewhere in the nasal area. And it's warms and moistures air intake. It warms and moistures air intake. Next is the mandible. The mandible has some parts to it. The body of the mandible, the angle of mandible, the ramus of the mandible, the mandibular condyle, mandibular condyle, the mandibular notch, it's like a curve in there, and the coronoid process is the tip of the curve. Continuing is the vertebral column. I'm continuing the vertebral column. Here is the cervical vertebra. Next is the thoracic vertebra. Next is the lumbar vertebra and the sacral vertebra. The two primary vertebrae are the thoracic and the sacral, and the two secondary vertebrae are the cervical and the lumbar. So the lumbar and the cervical are the secondary, while the thoracic and the sacral are the primary. Cervical vertebrae are 7 in number. The atlas vertebra articulates with the skull from superior. Thank you. Finishing up on the cervical vertebrae is the demonstration on myself. The cervical vertebrae can do 3 things. You can bend you are able to bend, you're able to stay straight, and you're able to tilt. What is unique about the transverse process of the cervical vertebrae compared to the thoracic and the lumbar vertebrae is that they have holes. The cervical vertebrae have holes. The cervical vertebrae have 3 foraminas, 1 vertebral foramina and 2 transverse foraminas, while the other transverse foraminus has only one foramina. That's what's unique about the cervical foraminus vertebrae. It has 3 holes, while the other ones has 1. Moving on. There are 12 thoracic vertebrae. The thoracic vertebra has 12 vertebrae. 12. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Pointing is the sphenoid process. The sphenoid process. The transverse process. I really can't show it. It's behind the transverse process. The intervertebral foramen is like a hole where it forges. The intervertebral foramen. The intervertebral disc can be seen internally. The intervertebral disc right here. Also, the body of, this is the body. This is the body. Okay. The lumbar vertebrae has 5 vertebrae. Are made of 5. The lumbar vertebrae. 1, 2, 3, 4, and 5 are the lumbar vertebrae. The sacrum vertebrae are also 5 in number. 1, 2, 3, 4, and 5 vertebrae. And here you can see the coccyx. Right here is the position of the coccyx. I missed something. There are the coccyx. The sternum. Moving on with the sternum. We're looking at the manubrim. The manubrim, the body of the sternum. The xiphoid process. Xiphoid process. Jugular notch is here. After this, here, the notch. The 12, the first 7 ribs are the true ribs. The true ribs. And these 3 here are the false ribs. While these 2 hanging off on this side are the floating ribs. Continuing with the ribs, pointing to the head of the rib. The head, the neck, and the tubercle. The head, the neck, the tubercle. Each of these thoracic vertebrae connects to a set of ribs. That concludes my video for this part of the homework. Thank you.